So welcome, Lieutenant Governor Calley.
Well, thanks for the invitation. It's great to be back in Grand Rapids in Kent County. And I thought what I'd do is I'd start with kind of a higher level discussion about the type of change that we are hoping to see in the response to the environmental contaminant of lead, which exists in so many places, so many living spaces across our state and certainly across the country. At a kind of the 10,000 foot level, what we're trying to accomplish is to move our system from a reactive system to a proactive system. So in the past, the way that the response to exposure to lead has been dealt with is that normally it would show up in somebody's blood in a blood test, and then there would be some sort of a response depending on whatever the community's local standards and capacities are, and that response would lead to a particular set of actions. The problem is, for that particular person, it's already too late to prevent the negative aspects of being exposed to lead. And so trying to move our whole system to one that is focused more on primary prevention, that ended up being what I consider the hallmark of the lead poisoning elimination task force. And as you can tell by the name, we didn't really want to think small. It's not the Childhood Lead Poisoning Reduction Board, it's Elimination Board. And we understood right from the onset that when it comes to eliminating this contaminant from every corner of our state, that this is a really tall order. This is a task that there's no easy way and no cheap way to deal with, but it's going to take disciplined, multi-level strategies from the local all the way up through to partnerships at the federal level in order to make this happen. And so while we had a set of recommendations which still try to increase and to expand the capacity for secondary prevention, there's been some sort of exposure, we know about it, and then how do we deal with it? That still has to be an important part of the plan, and capacity building has been a major challenge in nearly every community, and I think one that you've faced here as well. Even when you know about a hazard, having the size of the system that you need to identify the scope of it, and then the partners to actually eliminate that, and the resources to eliminate that contaminant is something that a lot of communities are struggling with. So one of the recommendations that got a lot of attention was the idea of going back to universal testing of young children. There was a time when that was the standard operating procedure. That was something that just happened, and we had a better sense for what the overall situation was and where the risks were, and there was a lot of strong and important information that came from that system. But as the overall lead contamination levels came down after changes in the 70s and the 80s, this more or less, I don't want to say total, for a lot of you, of course, around this table, it didn't fall off the radar screen, but for a lot of communities, it really hadn't been of the prominent level of importance in terms of response and attention for a long time, because compared to the past, our contamination levels and lead poisoning levels are much, much lower than they were when and I'm 40 years old, so when I was growing up, that what we consider to be an emergency today would have been much more common back then. And so it had kind of fallen off the radar screen in terms of the public health need and the requirements of it, and until we had the Flint water crisis. And it really did not just raise awareness, but also it's led to action on a lot of different levels. And it is my hope that the awareness and the determination that came from that will result in communities pulling together and partnering with the state and the federal government in order to eliminate this very old contaminant from our lives entirely.